Dallas Heart Walk is the largest heart walk in the country, and we're the largest participant in that heart walk. It's a great event, but not because it's the biggest, it's because people care enough to really make a difference and get involved, and it really changes lives. It's obviously raising money for critically important life-changing research, but it's also just raising awareness to people, as Deb mentioned, of the simple things they can do to not only change their lives, but change the lives of other people, and really impact the health and fitness of our community. I'll talk about that in a minute. So it's a wonderful event, and we should be proud of the fact that we're one of the key drivers behind that event. But it's really become part of our culture. When we joined this effort a few years ago, it was really the impetus for us to really focus on health and fitness at Oncor for our employees. We made the decision that there are a lot of things we get involved in, but we really want to focus on health and fitness for our employees and the community. And it really has changed our culture. I have employees come up to me in the hallway and tell me they've lost 10 pounds, or they've stopped smoking, or they're exercising for the first time in 20 years, or preparing for the first 5K, whatever it is. They tell me things that probably break hip rules. They tell me things, but it's really, you can see the enthusiasm among the employees, and the fact that we're sitting in meetings with employees talking about something other than the budget. We're talking about their health and their family's health, and them retiring healthy enough to play with their grandkids, and if they've got a life, we're trying to help them live that life. It really changes the culture in our relationship with our employees, so it's really been a real impetus for us as a company for our health and wellness programs. And those programs have resulted in some wonderful stories we've all heard of some of our employees who have really changed their lives. It's obviously allowed us to offer some programs to lower employee healthcare costs, do some things that people want to participate in those. So it's really part of a culture change here at the company. So one of the things I would ask, I really appreciate you taking the leadership role in this heart walk, is from my perspective, the real goal here is to get the buy-in, the commitment of our employees, rather than just the compliance of our employees. I'll take them anyway they'll come, but I'd rather they come on that Saturday morning because they want to be there, they believe in it, and they want to lead healthy lives, and they want to make a difference in the lives of other people, rather than, okay, I guess my boss wants me to come. So it's really, I think, part of changing people's perspective and view about health. And the last thing I want to talk about is healthcare is the #1 issue you hear about and you read about in the political environment today, right? The healthcare program, reform of Obamacare, whatever we're going to do to healthcare, and we debate changes to the delivery system, exchanges, more competition among insurance companies, pre-existing conditions, all this stuff that isn't changing the problem, right? Healthcare cost is 15% of GDP in this country, and it's the fastest growing component. It's affecting our economy, it's affecting the quality of people's lives, it's affecting our competitiveness as a country, our productivity because of the declining health of our people. You look at the rate of overweight and obesity amongst our children and amongst our adults. And in our adults, 2/3 of our adults in this country are either overweight or obese. 1/3 of our kids. Most kids can't pass a basic fitness and flexibility test. And we think, well, this is just a global trend because kids sit behind computers. Those rates are twice the rates of Europe. So the US is leading the world, and it's inactivity, it's poor diet, probably too much time behind computer screens, a lot of things. But these trends have to be arrested. And this debate, this political debate about exchanges and stuff, isn't fixing the problem. The problem can be addressed by lifestyle changes and prevention. And if we'll stop smoking, if we'll make modest changes in our diet and exercise, we can change it. We can cut that cost in half and change the world. So we really are, the goal here is to focus on the right things, not debate Obamacare versus Trump care versus something else. It's address the problem and fix the problem, and we change the world. Now, while a lot of it is things we can prevent, there is a tremendous gain by the medical research that's funded by Heart Walk. Tara's going to talk about her situation. We have the capability today to do things we couldn't have done 10 years ago. Right? We're saving lives today that we couldn't have changed in the past. So it's a great time to really be where we are, in a leadership position with the Heart Association and Heart Walk and the changes they can make in people's lives. So thank you very much for being here. And in addition addition to trying to get a bunch of crazy people out there in wild card t-shirts on that Saturday, let's change the culture, change people's hearts, and really get them to believe in this, and just keep that culture going on. Thank you so much, I appreciate it.